It's your girl AB, and I'm back again. So I have a good topic for you guys. So today I'm going to be showing you steps on how to create a good logic model for your business, for a project, or for your dissertation, for your thesis, and for your capstone, your school project. So basically, what is a logic model? So a logic model is a depiction of program showing what the program will do and what it is to accomplish. And also, it is a framework that shows the relationship between investment, activities, and result. So definitely, logic model shows is a pictorial diagram of your whole project. So I'm going to be showing you the steps on how to create a good logic model. This slide is showing the logic chain of connections, showing what the program is to accomplish. So for a logic model, these are the three components of a logic model. So your logic model must have the input column, the output column, and your outcome column. So under your input column, this comes with program investment, meaning what we invest. So what do we put in place in order to achieve our program objectives and goals? And then for the second column is the output. Under the output, we have two columns. So the first is the activities, what we do. What activities are we going to carry out in order to achieve this project? Then the second column under output is participation. Who we reach, who is our population, who is our target population, who are we serving? And the third column, which is the outcome, has three columns, which is the short-term outcomes, medium, and long-term outcomes. On my next slide, I'm going to be breaking down and in specific on how the input, output, and outcomes are being described with examples. So for the input columns, which is what we invest, so this comes with example: staff, volunteers, time, money, research base, materials, equipment, technology, and partners. So basically, what do I need? What manpower, what do I need in order to implement the project? And the next slide shows the output. So for this output columns, we're looking at the activities, which is what we do. So for the activities column, this means training sections you'll be conducting if you're having an educational intervention, teaching, deliver services, develop product, network with others, build partnerships, assess, facilitate, work with the media. So this basically deals with the activities you will be carrying out during the project in order to accomplish your program goals and objective. Then for the participation columns, like I said, this deals with who we reach, which is your participant. So your participants, your client, your customers, agency, decision makers, and policy makers. And the outcome column, this shows what result for individuals, families, and communities. So this basically shows what results you're going to get. So what am I accomplishing? What are my short-term results? What are my medium-term results? And what are my long-term results when I implement my program? So when you're implementing your programs, definitely you can even use a process assessment during your short-term outcomes. So for under those outcomes, we have the short-term outcomes. The short-term outcomes clearly deals with learning. So it comes with changes in awareness. So short-term outcomes are project goals or objectives, project result that is easy to measure. So for example, you're having an educational section and you want to measure knowledge. So what you basically do is to give a pretest before the educational intervention. Then after the educational intervention, then you give a pretest. With that, you can measure knowledge, the impact of knowledge. So you're going to know how they did before you give them the educational intervention. Then after you giving them the educational intervention, you take the post test in order to evaluate their knowledge. So with that is short-term outcomes are easily measured. So with short-term outcomes, you can measure awareness, changes in awareness, knowledge, attitudes, skills, opinion, aspiration, motivation, and behavioral intent. So intention. So behavioral intent is different from behavioral changes. Behavioral intent is when you ask someone, what are your intention of changing a behavior? So you're going to see on a scale of this to this, somebody can say, okay, on a scale of 1 to 10, maybe on the scale of 5, I intend to stop smoking or something like that. So it's behavioral intent. This is not behavioral changes. So short-term outcome does not does not measure behavioral changes. So on the second column is the medium outcome. So medium outcome, this is action. Like I said, short-term is learning. So we measure knowledge, attitude, awareness. Then medium outcome deals with action, which is changes in behavior. So definitely somebody who is smoking, stop smoking. And then you can measure that because the person stops smoking, and decision making as well in order to stop smoking, which is self-efficacy, and also changes in policy and changes in social actions. Then for the third column, these include conditions. So long term, this is long-term goal. This is a long-term goal, and it's been achieved in a long period of time. So basically, most projects, they don't really look into this, and most of the projects that really achieve their long-term goal is longitudinal studies and long-term studies like time series studies. So this shows changes in conditions, because that's when you can be able to measure if your project or your program made an impact to the entire population, not just your program participant, but to the entire population in the country or entire population in the state. So these changes look on conditions, social well-being, health, economic, civic, and environmental. We're going to work and use an example on how to create a logic model, but the example I'm going to be using is going to be health education or health behavior example, because I'm a public health specialist. So that is what I'm going to be using for today. So this is for program implementation or for evaluation. So this is our logic model. First, before you start a logic model, you start with your long-term goal. Do not start from input. So your long-term goal, because when you want to do a project, is your goal. So what you intend to achieve, that is what you look into. So first, we're going to work from the right-hand side. We're not starting from the left. We're not starting from left, not from input. We're starting from long-term goals right here. Long-term goals. So if you're starting from long-term goals, first you answer your question, what is the goal? Why do I want to implement this project? What is my goal? So the example we're using here, the goal, we have two goals here. So the goal first is to decrease injury rate, and second goal is to increase in parenting efficacy. So intermediate, then after we put down our goal, then we look into our immediate outcome. So if our long-term goal is to decrease injury rate and increase in parenting efficacy, so what is going to be our intermediate change, which is our medium outcome? Our medium outcomes which deals with behavioral change. So meaning there's gonna be what? There's gonna be increased use of car seats. So that is what we're changing. So if we want to decrease injury rate and want to increase in parenting efficacy, first change is going to be what? Increase use of car seats in order to what? Decrease injury rate. And our second change that we're looking at that our program is going to do to our participant is to secondly increase child supervision. So meaning parenting efficacy. So increase child supervision. That is what the behavior we want to change. And also the third behavior we want to change here is to increase in bonding activities. Then after we got our intermediate or our medium outcome changes, then we look to our short-term change. So if we're having the behavioral changes, so what are we going to do in order to have these behavioral changes from our participant? So short-term outcomes deals with what? Learning, increasing knowledge. So meaning we're going to give out educational materials. We're going to have educations with parents and also with other participants, the adults, in order for them to use seatbelt and educate them on the high risk of not using a seatbelt. So our short-term outcome, which is the learning outcome, will be what? To increase knowledge, increase prevention beliefs, which is prevention from not wearing a seatbelt, then increased confidence using seatbelts among our participants, and increase perceived control, so they have control over wearing seatbelt. Then after we have our long term, okay, so after we have our long term and our short term, and after we have our long term, our medium term and short term outcome, then we go ahead and say, okay, what activities? Then we'll go ahead to say, what outputs am I going to put in order to get? What output? What am I going to put? What output am I going to put in order for me to get my short-term goals, my medium-term goals, and my long-term outcomes? So what am I going to do? So the outputs comes with training manuals. Definitely, if you want to train parents and adults on using what? Seatbelt and how to use a seatbelt. So we have training manuals is going to be your outcome, so what you're given. And user's guide, education materials. Then for the activities column, what activities are we going to carry out? So we're going to what? Develop user guide. We're going to train educators, recruit volunteers, develop communication materials. Then after we do that, then we'll look at our input. So what are we going to input? How are we going to get this train educators, this recruit volunteers, and develop communication materials? How are we going to do that? So we'll go to foundation fundings because we need funds. Then you look for foundations that can fund you, then staff expertise that can take those trainings and train educators and develop communication materials. Then we look for hospital leadership in order to take those trainings, and also we look for existing resources. So this is the input. So this is how you create your logic model. Do you have any question? Okay, we can go over one more example. So this example is going to be, our goal is to reduce type 2 diabetes, and our long-term outcome should be looking at decrease in obesity. So our goal is to reduce type 2 diabetes. So in order for us to reduce type 2 diabetes, what is the next step for us to take? The next step for us to take is to what? Decrease in obesity. So decrease in obesity, that is the next step for us to take. So after you thought of the next step for us to take in decreasing obesity, then you look at for your medium outcome. So which is your behavioral changes. Always remember your medium outcome or intermediate outcome is your behavioral changes. In order for us to decrease obesity among our participants, what is the next step we think we should do? Is for us to what? Increase physical activity and healthy what? Eating behavior. So we want to see change in behavior in physical activities and healthy eating. Then after that, we're looking at our short-term outcome. So for our behavioral changes, in order for us to have our behavioral changes, what do we need to do? Is for us to have a short-term outcome. So what do we need to put in to get a behavioral changes? That comes with increase in knowledge, skills, and ability, which is what? Teaching your participants, educating your participants on the educating your participants in order to eat healthy food, eat vegetables and fruit, educating your participants how to rate calories, educating your participants how to read food labels. So this is what you do. So that is going to be your short-term outcome, increase in knowledge. So if you educate your participants on how to read food labels, definitely is going to impact their behavioral changes on healthy eating. And also if you give them education on the positive effect impact of physical activities, that will also teach them on how to conduct cardios and exercises that would impart that will impact their behavioral changes, which is increase in physical activities and healthy eating. So our short-term outcome is to create knowledge and skills and abilities. Then after we look at our short-term outcomes, so what do we think is output? So what are we going to do in order for us to get our short-term, in order for us to increase knowledge and skills in our participant? So is to what? Completed activities and examples of number of people participating in each event, number of newsletters distributed, number of classes conducted. So these are outputs we want to see. Then in order for us to have the number of participating in each event and the number of newsletters distributed, we need to have activities. So activities like cooking classes, newsletters, exercise classes, working groups, seminars. These are all activities, and physical activities. These are all activities that we'll carry out in order for us to get our outputs to do the number of participants in each event. Then after we put in the activities, so the next question is, how do we accomplish these activities? So who do we need to contact in order for us to implement this activity? So that is when we come with financial resources. What organizations are we going to meet? What foundations, what non-profit organization they can fund this program or activities? What stakeholders, who can I partner with? Then the human resources, this come with staffings. You can have volunteers, student volunteers, internships, interns, they can, that you put in there. Then also informational resources. So definitely this is on how to conduct a good logic model. So after you start from your goal, then you get it, then you go through and say input, financial resources, human resources, then goes with what? Your activities, which is cooking class, newsletters, exercise classes, working groups. Then we look at our output. So after we put in these activities, what do we get? We get an output, which is number of participants participating in each event, number of newsletters that was distributed, number of classes that was conducted, which is your output. So basically, activities is different from your output. Activities is the cooking class, what you're going to be having during your project. Then output, meaning what are the things you give them, the number of classes you give them, the number of classes you conducted, number of people who participated in the event. And then this leads to your short-term outcomes. So after conducting these activities, short-term outcomes deals with learning, changes in learning. So we say increase in knowledge, skills, and abilities to carry out physical activities and to eat healthy. So after having those knowledge and learning those skills on how to cook healthy food, then we go to our intermediate or medium outcomes, which gives the increase in physical activities and healthy eating. So after they have knowledge of physical activity and after they have classes, exercise classes, and after they have classes on how to cook healthy eating, this is going to increase physical activity and healthy eating behaviors among the participants. Then this would lead to our long-term goal, decrease in obesity. Then after decreasing obesity, then we see our goal, which is going to be reducing what? Type 2 diabetes among your participants. Thank you. And please do not forget to subscribe to my channel. Please hit the subscription link and subscribe to my YouTube channel.